I'd like to introduce Jane Morgan, who, for those of you who don't know, is the director of our wonderful Training and Technical Assistance Network, who will introduce the next session.
Thank you, Christine. And I want to join Heidi and Christine in welcoming all of you to Washington. It's so wonderful to see all of those who've been here before at some of our national meetings for adoption and foster care specialists, but to see so many new faces, it's a great opportunity for us to all engage and work together, and to also now have the family preservation specialist with us is very exciting. I think you're in for a real treat with this next presentation. I just want to say that after the hurricanes Katrina and Rita tore through Louisiana, devastated New Orleans, and the Gulf Coast, we had an opportunity at the Children's Bureau to go into Louisiana and meet with Marquita and her staff a few months actually after the hurricane had come through. And I want to tell you that we've gone in there, and our team is, our presenters are going to talk about this, but we went in there to renegotiate their program improvement plan, but to talk about training and technical assistance and how we could assist the state. And we spent a couple of days listening to Marquita and her staff talk about the experience of what had happened. And throughout that entire time we were with them, they had all been very traumatized, had worked so hard, had cared for the children and the families that they were entrusted to serve. But you heard throughout the whole time we were there this look for the opportunity in this tremendous challenge that they were all facing. And so I think it's going to be really exciting to hear from them. Marquita clearly had a vision for where she wanted to take the agency and saw this as an opportunity to further their systems reform efforts. So I'm really looking forward with you to hearing what they have to tell us today. And our speakers are Chris Sahanchek, and Chris is the Director of Strategy and Coordination for the National Child Welfare Resource Center for Organizational Improvement. She's responsible for developing the National Training and Technical Assistance Strategy and coordinating the TNTA Assistance Network. This involves evaluating systems and programs and developing strategies for systems improvement and assisting with the implementation and further evaluation. Formerly, in her role as the Director of Organizational Improvement, she facilitated the development and implementation of plans for children's services in over a dozen states, the District of Columbia, and Puerto Rico. She's worked with states and tribes on developing integrated service systems and has worked with court systems in over a dozen jurisdictions and in collaboration with the American Bar Association to develop assessment and planning tools for state court improvement projects. We're also going to hear from Will Hornsby from the Children's Bureau. He's the CFSR Division Supervisor and leads the Children's Bureau's team focused on the national implementation of the Child and Family Services Review. Prior to joining the federal government, Will worked in the field of public child welfare in both the county and state level in Alabama, Department of Human Services, and he got a master's in social work degree from the University of Alabama. And last, we're going to hear from Marquita Garner-Goutreau, who is the Assistant Secretary for the Office of Community Services for the Louisiana Department of Social Services. Marquita was appointed Assistant Secretary for the Office of Community Services in 2004. The Office of Community Services is the organizational entity of the Louisiana Department of Social Services that has responsibility for administering child welfare programs and services to Louisiana's children, youth, and families. Prior to being tapped as Assistant Secretary, her career included nonprofit leadership roles as President and CEO of Prevent Child Abuse Louisiana and executive positions with the American Heart Association in both Louisiana and Mississippi. She's been an enthusiastic and committed advocate for children and youth and families for over 25 years. Her passion for prevention services and transparency in government has helped shape the new Office of Community Services. Under her leadership, Louisiana's child welfare system is undergoing extensive reform and becoming more proactive in prevention efforts. And I'm going to turn it over to Chris.
Good morning, everyone. I am very excited to be here because I rarely get to be at this meeting. with all the foster care managers and adoption managers and family preservation folks. It is really exciting for me because I have a tendency to spend much more time talking to child welfare directors. And I have to tell you that you folks are really the ones who, it's not that the child welfare directors don't create the vision, but you're the ones who are implementing the vision. And the more I'm able to share some of my ideas with you and sort of some of the research, I feel that it really is going to get further and further into supervision and practice and management. So the name of our presentation here is the CFSR and Beyond, Achieving Agency, Systemic and Culture Change. And what I like to think about when I'm talking about this is this idea of connecting the dots. And I am going to spend my time in the presentation talking very specifically about sort of the research, the management theory that's behind public administration, and then we're going to go really into Louisiana and a national perspective from Will. But what I want to do is really start with the dots. And if you can see this, I hope you can see that this is actually a pointillism picture of many, many dots. And the reason why I have this up here is because you think that there are many different colors of dots, but there really aren't many colors of dots. There are really a number of primary colors, and the way those primary colors are organized really creates the vision, and it creates also this impression of sort of other colors, but again, it really is primary colors. And to a certain extent, I think that this is what creating a vision and implementing a vision really looks like in child welfare. And the reason why I say that is that it isn't just one thing you do or just a few dots. It has to be all of these different dots, and only through all of those different dots do you really create a system and do you really create change. And these are commonly identified elements that are necessary to achieve systemic change. And this isn't really just my work. This is sort of my what I pulled, and you can see the sources in your handouts from people who have done this work, really much more research-based, plus some observations from me. And my observations are really, I mean, they really go from many years of working with states, but I mean, I think about this from, when I was 26 and I was clerking for a judge and I wrote my first order for termination of parental rights. I mean, it really is through the years thinking about all the different pieces. So I am going to start with what is so important is, and again, this is the review of the literature together, and that's leadership. And when I'm thinking about leadership, it's not just the leadership in terms of creating the vision, because that's really the second item, but also that idea of commitment and sponsorship and really creating a sense of urgency. It is that idea of being a leader who says this is really important and this is the priority and we really have to make this happen. And then we have the second one, vision, which is really related to the idea of actually developing it and implementing it. And then thinking of next, the involvement of internal and external stakeholders. And when I think of stakeholders, it is that idea of vertical, thinking about who is really involved within the agency. And it is from the top on down, and it's horizontal as well. So it's really thinking through not just, what is happening on the front line with caseworkers and case aides and everyone else, but it's also thinking about what's happening with county directors and regional directors and all of those folks who aren't necessarily always in our minds when we're thinking about rolling these things out. And then it really is the external stakeholders. We wouldn't be here if it wasn't, the work wouldn't be done if it wasn't for the foster parents, the adoptive parents, all the family members. It really is so crucial that when we're thinking wide as well in terms of stakeholders. And then most important is really are the engaged families. Because if you don't have engaged families, you really don't know need. You really don't understand need, and you also don't understand the dreams and the hopes. So the more we have the families involved, the more we're really able to understand that in a very deep way. And then the other part for me, too, is the importance of the families in understanding the culture, in understanding how things can be culturally responsive. Because once again, if you don't understand that, whatever you develop is not going to really be targeted. And then the next area for me is the environmental scan. And that really is the idea of understanding where is the support, where's the resistance, really looking at it throughout to make sure that whatever you want to do, you really understand what the environment is and whether this is doable, or if there are barriers, you identify them. And then next we have communication, and that really is making sure that what you're thinking in your mind and what you're saying to a few of your other fellow managers is really communicated to everyone that you want to have shared. Because I think so often we think things, we have expectations, but there isn't a clarity in terms of the communication, and so that everyone really knows. We don't want everyone to know everything we're thinking. But we certainly want them to know what our hopes and dreams and sort of the priorities and what we're expecting from them. And then we have a few other items, cross-functional and cross-organizational teams. And that really, for me, is thinking through, how you can do things across the board with guiding a project, managing the details, and solving problems. I think that there's a tendency sometimes to stay within our own unit, and it really is a question of if you're really going to do something, more than likely it's going to be across an agency, and making sure that all the team members really are part of this. And then the next one, which sounds very bureaucratic and very dry, is unfortunately my favorite, because this is really the piece, I think, that you need more than anything else to make sure that practice really is what it should be. And it is that idea of making sure that policy is aligned with practice, and that you really have training to support it. And so everything is really going along the same way. So in other words, you might be training caseworkers on something, but you really want to make sure that the supervisors are trained on it as well, and make sure that you're really monitoring it through your quality improvement. And the same thing, you can go in many different directions with this, but I always think of this as supporting, all these pieces need to be there to support each other. And then with that is, of course, how is there an alignment of organizational structures? And with this, I'm really thinking about making sure that it really is organized and integrated, so that it's not just what's happening in practice or supervision. It's making sure that your contracting department is on board with these things. There really are the services that you need. And then another example for me is our job descriptions. So often the job descriptions really don't match the work that we're asking people to do. So that's another important piece for me. It's like the little details, but they're in other sectors. And then, of course, the next one is resources, because that's in some ways what we always think of first. But it's not just resources in terms of money. If you think about it, it's resources in terms of time, it's resources in terms of coaching, and that idea of when you really do something as a team, it does take longer, but it usually turns out better. And then last, the monitoring and evaluation. And it is thinking through, well, what are the findings of what I'm doing? And then what is the next stage, the feedback loop? And then most important, after the feedback, it's really making the adjustments. So really taking what you're learning and really changing the way you're doing things. And then I also added, actually a colleague suggested that I mention rewards and sanctions, because I think that I don't know how often we really use performance appraisals these days. And there are ways of doing performance appraisals in a way that it really does support the priorities that you set. And so I added that on. All of this, you can find additional information about this, but I'm sort of the dry part of the presentation, the background. I'm going to spend a couple times reviewing the Child and Family Services Review because I know that you know these, and you're going to know beyond safety, permanency, and well-being, you're going to know the systemic factors. But this is the reason why I'm talking about this, is that for me, the CFSR, and I've worked with many states on statewide assessments and developing program improvement plans. The CFSR isn't really, it isn't just an event. It truly, truly, truly is, I think, a tool that you can utilize to achieve systems change and culture change. And the reason why I say this is because the folks who developed the review itself, said this. And it's thinking about, they thought about this. They thought about how do we really get the values that matter, the idea of family-based practice, community-based services, strengths-based management, a strengths-based review process. How do you really infuse that in a process? And that's what they did. They took it and they really started thinking about how to utilize it. And so the reason why I'm focusing on this is because I think that this really helps you, in a way, connect the dots. If you think about, I'm just going to go through some examples that I have. If you think about this, it really focuses on all of those necessary dots that I showed you earlier, on what the management literature says, you know, all of the stuff that it really is strong management theory for how you really make sure change occurs. Because it's not just social work practice, it's really management practice. And if you look at a few of the areas, you can see that they're really the same. The CFSR is looking at the involvement of internal and external stakeholders. It's looking very closely at engaging families. And it really is, in some ways, a big environmental scan, because that's what the assessment is really doing. It's looking at how you're doing specifically in safety, permanency, and well-being, but it's also looking at, is there the infrastructure here to really do what you want to do? Because if you go back to those other pieces, you really need to have the training. You need to have sort of the interagency collaboration. And it has all of those pieces, and especially the monitoring and the evaluation. And then you are saying to me, well, what does this mean to me? You may or you may not be thinking that, but I would be thinking that. I would be thinking, why is this woman sharing all of this research with me? And the reason why is because you are the leadership. If you are not, you are here. If you're not doing this, then the system change really is not going to occur. The change does happen here. I'm not going to say that it doesn't happen with the senior managers, like the secretaries, the department directors that are way floating above. But it really happens with the managers who are in charge of these areas, who are doing the work and setting the vision specifically for program areas. And you guys actually being in a room together is very important, because the cross-functional and cross-organizational teams are actually sitting in this room. You have, in some ways, the primary people that you need, the relationship between the foster care manager, prevention, and adoption. I mean, that they're all one and the same if you think about it, especially given that adoption, like, I just think about this, if so many of adoptive parents are coming from the foster parent pool, that relationship to me is so critical, that you're talking to each other and that the encounter with the agency is such a positive working relationship. And then there are other areas, again, the alignment and realignment of policy, practice, training, and quality improvement. All of those pieces are within the CFSR. And fortunately or unfortunately, all of those dots need to be addressed in order to create the vision. And so I'm going to move on and there's others. I mean, I could go on and on doing a cross comparison. This is, for many, I'm hoping that you can figure out what this is. This is the last image that I'm going to leave you with. And the reason why I'm leaving you with this is not because I grow pumpkins. Many people here know this. I do grow pumpkins. I love pumpkins. And it's not because it is this time of year a seasonal image. But it is for me that it's doable. It really is doable to think about how you draw something with dots, how you can create a vision, and how you really can connect them. And this is something that we've all been doing since we were very, very young, creating this kind of image and connecting dots. And so I wanted to leave you with this because I think it is that you start small, you think about what you want the picture to look like, what the vision to be, you connect the dots, and then you're able to achieve your goals. And so that's the research, that's the overview, and I think this is all doable.
Okay, the title of this presentation is CFSR and Beyond, Achieving Agency Systemic and Culture Change. But I have to tell you, there have been some moments during the 18 CFSRs during FY08 when I wasn't sure there was anything beyond the on-site review week event, as Chris was saying. I'm actually breathing a little easier now that it's October, and in FY09 we have 10 reviews scheduled, and in FY10 we have 10 reviews scheduled. You may not be worried about that, but it is a nice thing from our end. As you can see from this slide, we've completed 32 of the 52 on-site second-round CFSRs. We're working very hard to complete the final reports for the FY08 reviews that we just finished at the end of September. And as Christine said this morning, we haven't had a chance to go through and aggregate the findings yet from the second round, and we haven't been able to spend significant time analyzing the results of the reviews thus far. With this being said, I do want to spend a few minutes talking about some changes designed to result in improved outcomes for the families we all serve that we've seen states putting in place. And then Marquita is going to be able to talk specifically about Louisiana. To begin with, the Children's Bureau has stressed throughout our work with states on program improvement that it's imperative for PIPs to be connected to an overall vision for the agency and for there to be clearly identified values, principles, and expectations to guide what happens between that frontline worker and the families that they serve. Oftentimes, these values, principles, and expectations are articulated through a practice model. And it's fair to say that when we've been in states speaking with the agency leads, and they've talked about the improvements that they're seeing, oftentimes they're relating that to their practice model and where they are with trying to implement the practice model. For example, in North Carolina, we heard about how their multiple response system has changed how their agency interacts with families they serve. I mean, this is a change in how they are connecting with families. During the second round Montana CFSR this past summer, there was one of the 3 sites that clearly performed stronger on the outcomes. And as we were probing on that Friday morning about why the ratings were higher for that site, it was interesting because the agency personnel said that that office has fundamentally incorporated family-centered practice principles into the way that they're doing business. They're saying that about themselves, that they've identified that about the practice in that office compared to the other 2 sites where we were. So that means the leadership in that office has found a way to operationalize family-centered principles and values, and that families are being treated in a different manner. And the agency personnel were attributing and believing that that explains a major reason why we saw stronger performance at that site. So, kind of as Chris was saying this morning, think about your state, think about where you are in the organization, and think about the concrete ways that you assist your agency with fundamentally implementing your agency's values, principles, and expectations. And those are not hollow words. Are you taking concrete steps to push what your agency believes in? And I'm telling you, from getting the opportunity of going across the country, it varies. And there are states where this is important to leadership, and it's important from the top all the way to the supervisor level and the staff. The results of the first round of CFSRs showed us that there's a relationship between certain practices and achievement of outcomes. Some of these practices include caseworker visits with children and caseworker visits with parents. During the second round of reviews, there are some states that have shown improvement, and I've got based on preliminary results. We're big on preliminary at this moment. In caseworker visits with children. And the interesting thing is we've learned that states are focusing a great deal of effort not only on the frequency, but on what is happening. What's the quality of those visits with the children? For the 14 states reviewed in FY07, okay, listen to this here. For the 14 states reviewed in FY07, all of the states performed stronger on caseworker visits with children than on caseworker visits with parents. Okay? For perspective, the highest rated states, there were two, for caseworker visits with children, they were at 88% strengths on the cases reviewed. So that means for the randomly selected 65 cases, 88% of them were strengths for caseworker visits with children. The lowest rated state for this item was 39% strengths on the cases reviewed. So that means in the 65 cases reviewed, 39% of them were rated as a strength for caseworker visits in the lowest rated state. However, the highest rated state for caseworker visits with parents was at 78% strengths on the cases reviewed, and the lowest rated state for this item was 23% strengths on the cases reviewed. I'm pointing this out for two reasons. If you've been at our meetings from the first round, we talked about the connection between caseworker visits and outcomes. We're in the second round. We're seeing that this is clearly an area of practice that still needs attention and needs improvement. And I guess the other reason of wanting to point this out is because this is one of those clear areas where we see the impact of how well or how poorly the state agency is engaging non-custodial parents, absent parents. Oftentimes, it's the fathers. But caseworker visits with parents, many times when the trend that you can see across the state is the fact that the non-custodial parent is not being contacted and not being engaged. So with that, I want to talk a minute about engagement. Although there are clear challenges around locating and engaging non-custodial or absent parents, we've seen instances where states are effectively using forms of family team meetings or family group conferencing to engage parents in the case planning process. However, during the second round of CFSRs, we've seen instances when these approaches are only used for certain populations or at certain points during a case, and this results in a lack of consistency around engagement. It seems in those states or those sites where the agency leadership has made the decision to use some type of process systematically with all families to encourage that they have a meaningful voice in the case planning process, then you're seeing that principle of family involvement being implemented in a more concrete manner. In conducting our reviews in New Mexico and North Carolina during the second round, we learned about a promising practice to engage foster parents and birth parents as partners in a way that allows them to focus on the needs of the child together. During these reviews, we heard from foster parents, birth parents, workers, and several other stakeholders about how shared parenting in North Carolina and icebreakers in New Mexico have positively impacted the way that they view their roles of foster and birth parents, and has established relationships between the two that benefit children. For example, the reviewers noted, seeing in cases they reviewed, how they saw foster parents mentoring birth parents and taking an active role in helping to facilitate parent and child visitation. Actually, last year with the adoption managers, I used this example, and I think I said something to the effect of, that's more valuable than gold. And when you have a system to where your foster parents are connecting and engaging with the birth parents and your system is nurturing that, it's very, very valuable and something to be nurtured and sustained. During the second round of CFSRs, we've seen evidence of states that are tackling the challenge of how to improve supervision. It's very interesting because during stakeholder interviews, the topic often arises about how the quality of supervision impacts what's happening for families served. And that's without us directly asking the question. That's, speaking with external stakeholders, speaking with internal stakeholders, and oftentimes the discussion will go to how important supervision is. And to improve supervision, clearly there are workforce and training implications. But when you think about just what we've talked about thus far, trying to uniformly communicate and reinforce agency principles, values, and expectations, trying to improve worker contact with children and parents, trying to strengthen family engagement, these things are not going to happen without effective supervision. If you've attended a Friday statewide exit conference during the second round of CFSRs, you may have heard us identify some foundations for continued improvement that we identified during the review week. During some of these exit conferences, we've highlighted states or specific sites that are using systems of care principles to strengthen their practice. And it's interesting because we've seen system of care principles being embedded in policy, informing contract expectations, and also helping to serve to kind of form a common ground between the Child Welfare Agency and between their external partners to strengthen communication, to strengthen collaboration. So what I've wanted to do here is with Chris saying this is doable, here are 5 examples of changes that we're seeing states put in place to try to strengthen what's happening for families. And it's very interesting being involved in the second round of reviews and thinking about beyond. All you have to do is say third round of CFSRs, and some people shake. But it really is, it's actually exciting to be in a state where they have purposely looked at what their performance was during the first round, where they are now, and how to continue moving forward, how to continue improving, and that's their focus And it's not in this pass-fail type of mentality, but it's how do we continue moving forward? And there are clearly states that are taking that approach. Okay. Before handing things over to Marquita, I want to briefly mention 3 characteristics of successful PIPs that our unit has identified as we work with states during round 1 of the CFSRs. So, Chris, it's interesting to me because thinking about the research and what you presented, this was from us sitting around and thinking about where we've seen the more effective program improvement plans, where we've seen states that seem to be really moving forward. What are some of those common characteristics? Strong and consistent leadership, appropriate funding, and inclusion of stakeholders. These characteristics may seem to be of an obvious nature, but in the volatile world of public child welfare, they're definitely not always present, and it takes hard work and at times good fortune to have one or more of these characteristics present throughout PIP development and implementation. With this being said, I've been so looking forward to hearing from Marquita because I feel like the dry part of this presentation has been thus far. And it really is to think about being able to witness leadership in the midst of some serious challenges and to look at those as being opportunities to improve your system. We're going to hear from somebody who's done that. So, Marquita.
I swear I feel like I need to be telling Boudreaux and Thibodeau jokes or something if I'm the entertainment part of this. I love talking about Louisiana, and I love talking about what we've done because it has been a wild ride for the past 3 years. When I came in with the Blanco administration 5 years ago, I was one of those really scary people that for those of you that grew up in child welfare and here comes this appointed person from the governor and there's somebody from the outside and you don't know what they believe and who they are and what their value system is, and they scare you to death and you think, here we go again. One more new governor, one more new secretary, one more new whatever, and God only knows what they'll do to us. And so for me, I was very lucky that as the CEO of Prevent Child Abuse Louisiana, I had worked alongside the Office of Community Services for 9 years. And I felt like I knew the system as well as any outsider could know the system. But I'm not a social worker. And so I'm not the brightest bulb always in the thing, but I do know what I don't know. And so the first year, I really feel like I spent a lot of time just traveling the state and listening to staff about what they wanted, if they could create a world that was theirs without all the interference from policy and governor and bureaucracy. What did they do? What did they want? And what I heard over and over and over is we really want to get back to social work. We've really gotten to this place where we fill out forms and we do paperwork and we don't engage with families the way we really want to. And the sense of humanity that brought this staff to this work was that they loved helping families and they wanted to do the right thing for families, but they got so sidetracked by the bureaucracy. And so, as I'm listening and learning and trying to absorb all of this, I always have come from a belief system that you're called into the work you're supposed to do. And it doesn't matter what the work is. We all have a lot of different callings to make this whole system of humanity work. But that if you're really called into what you're supposed to do, you're going to love it and you're going to be connected to it at a level that is more than a paycheck or an 8-to-5 job or something that you can't wait to go on vacation away from, that it's something you really want to do. And that's what I saw in the men and women of OCS in Louisiana. They loved this work, but they were really being sidetracked by all the stuff that goes on. And in Louisiana, our world will ever be pre and post Katrina. That is just now the reality of who we are. And I also have this belief system that there's always a silver lining, and no matter how awful and horrible something is, somewhere, somehow, something good will come out of that. And even at this stage and age of my life, I still have this Pollyanna mentality that there's always a good thing that can come out of a bad thing, and there's always a good reason, maybe not a reason, but a good thing that can follow something tragic. And so for us in Louisiana, figuring out what the hell that was out of Katrina was a big job, because Katrina knocked us down. Just for those of you that don't know, in our ESF6, Emergency Support Function, in the state of Louisiana, the child welfare system is responsible for sheltering, evacuation, and mass housing. So when a storm comes, and pre-Katrina, this wasn't such a bad deal, because usually a hurricane blows in, you're down about a week, and everybody goes home, and you go back. Well, we didn't just have a hurricane. We had a flood, because the levees broke. And so all of a sudden, that infamous bowl that you all heard about New Orleans being a bowl, so many times I thought I was going to throw up if I heard it was a bowl again, and all the water dumped in the wrong place. And so all of a sudden, we have, out of 1,800 employees, 900 of our employees were deployed to shelter duty. And they didn't go for a week. They went for months. 600 of our employees evacuated because their homes were in that bowl that got flooded. And so that left, as best I can tell, about 300 people to do the work of 1,800 people. And that went on for a very long time. We had 2,000 foster children in the Katrina area, and they became our Katrina class that we tracked almost like you track a lawsuit kind of class for the next, now 3 years. And if the gods weren't mad enough, 3.5 weeks later, Rita came. And I don't know if you really remember Rita, but had Katrina not come, it would have been the largest hurricane to enter the Gulf of Mexico in the world's history. So we had Katrina, then we had Rita. We have 500 more children in Rita that were evacuated. So we had 2,500 foster kids, which was half of our system, all over the nation. Many of you had them in your state for a while, because it took us a while to get everybody home. So as we were, here's little Pollyanna trying to find a silver lining in this thing, and it took a while. But what I knew about my staff was that they always do the right thing, and they do it for the right reason, and they do it because they're called to a higher purpose of service. And it was just this amazing work. I have to tell one story. I was at the command center when the levees broke, and we got this call from New Orleans, and they said, we've got kids that are, being rescued off of the rooftops, and so we're putting them on a bus, and we're fixing them to send them to you. So you need a shelter for kids. I thought, that's not part of the emergency support function training. We don't have a shelter for kids. So I called John McInturf, who is in our program director, and I said, John, we need a shelter for kids. And he said, oh, okay. And I said, I don't know how many. I don't know what age. I don't know what size. All I know is they're wet, coming off of rooftops, off of the flood, out of the boats. So go. And he did. And we had a shelter for kids that was unbelievable. And that's the kind of staff that we have. And I watched all these other people in total chaos and frenzy that were in transportation and DQ and labor, and they didn't know how, and all I had to say was go, and it was done. because they're crisis managers. You live in crisis in this system. You deal with crisis every single day. It is your daily work. You don't get stymied by something that feels larger than life and bigger than humanly possible. And so with just that simple sentence, we had this amazing shelter. Now I know that there were, a dozen people with him that made all that happen and got car seats and got formula and got blankets and got clothes of every size and shape. And, it took a lot of work to pull all that together. But the point is, when you're in this room, you're a person who has decided to do this work, not for fame, not for fortune, not for high praise. You have decided to do it because you believe in the value of families. And that's what keeps you here through all the turnover and change and volatility in this system. And so as we got to the post-Katrina world, then it was, okay, how do we go from here? And how do we do better than just recover? Because recovery had to happen. But we had this incredible opportunity in Louisiana to do better than just recover, and not to build it back the way it was, but to build it the way that I had heard staff say they wanted it to be. And so for me as the leader, that was the driving quotient. It was, I heard you say what you wanted. And now, because of all the craziness of this world and the volatility of global warming and big hurricanes, we have a chance to build this the way we want it to be. And we've still got the same political structure, and we've still got the same funding problems that everybody else has. But if we can start with kind of almost a clean slate and build what we want, then maybe the funding will come. And so another one of my favorite stories about Louisiana is when I first got there, I came in with this real prevention mindset. I came from Prevent Child Abuse Louisiana, come on. So, I came in with this prevention mindset of, we really shouldn't have all these kids in foster care. We ought to keep them out of foster care, really ought to be working with families and stabilizing them, intervene early, and keep them safe and never bring them into the system. And so I identified very quickly within my leadership a person who was very like-minded in that with me. And so I said to her, I want you to create the best prevention service continuum in the world. I want you to do all the research, find the best programs, find the best policy, the best practice, search the nation, do whatever you have to do, but I want you to create this wonderful prevention program. We didn't have prevention in our statute, so the first thing we had to do was bring a law that, a bill that would amend the statute for the Office of Community Services to be able to do prevention, because it's really hard to ask for money for prevention in the budget cycle when it's not in your statute. So I said, so go ahead, and while we're, all that's, we'll get to that, but just create this wonderful thing. And then I said, you don't have any money, you don't have any staff, but, we'll get to that. We'll get there. And she happens to be in the room. Miss Hodnett, would you wave your hand? And so she did. And so then, amazingly, after Katrina, we got congressional funding. And I looked at Renda and said, guess what? All that work that you've done, here's $5 million, go. And so overnight, we were ready because we had done the work, because it was the right thing to do. And it was the right way to work with families. And so virtually, not overnight, but very, very quickly, we were able to begin the kind of prevention, early intervention programs that we had always wanted to do. And so if you look at this continuum of care, the top one says current. That's what we walked in the door with. And it really was this huge foster care middle. Like most child welfare systems, you've just got this chunk of all your work is foster care. And you've got adoption down at the end, and maybe you spend a little money on your kids that are aging out, and you have your CPI beginning, how you get in the door, how you get to us, and the very early part of the system. But the bulk of the system is taking care of those kids in custody, right? That's what we do. And so I also walked in the door to this litany of alphabet soup. They had just gotten this thing, and I say they because I have, as proud as I am, I had nothing to do with the fact that we were the 3rd accredited child welfare agency in the nation by COA. So the very first thing I got to do was get the plaque, and I felt really bad because I hadn't done any of the work, but I got to stand there and receive the plaque at this convention in New Orleans. But I brought my mom down so she could see it just in case. It never hurts to show off in front of your parents and say, see, you did a good job. So I knew about COA, and I knew what that meant, and I knew that there was this thing called the PIP. I wasn't sure what a PIP was, but I knew that we had one and that it was consuming everybody in the building. It was all about the PIP, and we couldn't do that because of the PIP, or we had to do this because of the PIP. And I was like, damn, I better ask what that is. I kept thinking I'd find it in my office somewhere. There'd be a code that would tell me what all these letters meant, so I wouldn't have to look quite as unintelligent as I felt. And so then I figured out that the PIP was tied to the CSFR. Y'all are great at acronyms and letters that mean nothing to an outsider. So as we move through this, what I learned very quickly was that everything I had heard staff talk about was embedded in this document, in the CSFR. We had to renegotiate our program improvement plan after Katrina because our world was not the same as it had been pre-Katrina. So that gave us the opportunity to really look at what it was we wanted to do and how we made that fit into a program improvement plan that got us where we wanted to be with the CSFR. And I really, what I have said in front of our legislature over and over and over, and to the governor and our stakeholders and anybody else that'll listen, is that we needed a federal standard to be held accountable to. I think any agency, any business, any entity needs a standard of service and practice that it should be held accountable to. I think that's the way you constantly achieve to do better. Now, it doesn't always feel good, and it isn't always fun, and sometimes the compliance pieces drive you nuts, and you feel like you're back into the paperwork. But if you look at the core of what it means, and you look at the core of the 3 areas that we're told to focus on and to work on, that's what called you here anyway. You came here to keep children safe. You came here to get them to permanency. You came here to make sure that they lived healthy and well lives. And so driving our practice toward the standards within this thing that the feds had really wasn't hard because it was what you wanted to do anyway. It's what brought you here. So as we looked at our continuum of care and how we could go, what time do I have to stop? What time is this session over? 10:30. Okay. Oh, good. I have lots of time. I got time. So what we decided to do when we were in our rebuilding mode was literally just take the system apart and start at the front end where you come in the door. And the fun thing about working in this post-Katrina world has been it's really kind of been hands-off. We had some congressional money come in that gave us resources we had never had. And then we had the Annie E. Casey Foundation come in to want to work with us to bring some additional resources. And then we had this remarkable conversation with Chris and with Gary and with Will that said, there's extra money for technical assistance, so ask for whatever it is you want. Okay, this sounds really, really good to me. Ask for whatever it is you want. So we have been consistently doing that daily for the past 3 years. And I know that when Chris must have my name, and when I call and it comes up in Marquita, she must just hide because, oh God, what can she want now? Because I call and go, Chris, I know we're already, committed, wide and tall. But guess what else we've thought of that we could use help with? And it's just been this remarkable system of assistance that has come into Louisiana. Now, I hate to say that it took a hurricane to make that happen. But that's that Pollyanna side of me that can see the silver lining. And if that's what it took to get us there, oh, well, here we are. Let's use it to its deepest and widest and broadest scope. So we literally looked at the very front end of how a child comes into the system. When we answer the phone and say, we're taking this report of child abuse. And we added an alternate response, which was something that from my outside work with the agency, I had really understood that was critical. That there are so many of our cases in Louisiana are neglect cases. We have a very, very high poverty rate in our state. And an awful lot of the people that end up coming into the system just for services. And it really isn't that they have been so traumatically abused that they need to be in foster care. They just don't have the mental health services or just the community-based services that they needed to get over whatever this little plateau of trouble is in their life. Now, we've also got the horrendous stuff that every system has, but an awful lot of our families come into us because there was no other venue to get the help they needed. And so we were able, with the alternate response, to be able to say, and just within our own resources, no new money for that, we just, as far as staff was concerned, we just took our staff and let them kind of self-select who really wants to focus on the CPI investigation and who really wants to go in and do a family assessment and say, you know what got you here? Why'd you come to the state's attention? What's going on in this house? How do we help you stabilize, keep these kids safe, keep them at home, and not bring you into custody? And we've been very methodical as we've had a sense of urgency. I loved when Chris said that leaders had to have a sense of urgency. The thing that we knew immediately post-Katrina was that our governor was in real trouble politically, and the chances of her being reelected were pretty slim. We got the congressional money that had a time clock on it. And so those two things combined gave us a window of anywhere from 18 months to 2 years. So we really had a sense of urgency because it wasn't that we were going to just focus on alternate response and get that really good and solid. We were going to do everything across the board, and we were going to do it in 18 months because we were going to spend every nickel of that money and anybody else's we could get our hands on. Because I figured out early that if you didn't spend your money, they were going to send it back to the feds. And I also figured out that SSBG comes through the Office of Community Services. So I could be a roadblock to it going back, and I could absorb it. So we figured out we'd spend all our money and anybody else's that didn't spend theirs, and we did. And so we started with the alternate response piece, and then we went into what does it look like when you actually come into foster care? And I'd spend a lot of time meeting with foster parents, and I give them my personal cell phone number, and I tell them to call me when they get aggravated or if they hit a roadblock or if they get nervous or, feel like they're not getting their, the best service that they can get. Because how am I going to know? I mean, Chris said we live way up here, and, I'm out in the field an awful lot. But most workers are not going to come up and go, I don't call my foster parents. I don't see them as often as I should. Not really talking to them and doing all the visits. So the only way I'm going to know is if the foster parents tell me, right? So I give them my phone number. In the first year, nobody called it. I thought, that's really weird. I told them they could call me. I meant they could call me. I'm a real open door kind of person. So the second year when I gave them my phone number, and I said, I don't know why any of y'all never called. I mean, the only time I talk to you is during legislation or if I come to you. Well, that opened the floodgates, and now they know my number. I'm on their speed dial, and so I know a lot about what goes on with our foster parents. And the one thing that I kept hearing and understanding was we spend an awful lot of time in staff meetings deciding what should happen with kids. We don't always have the foster parent at that table talking about what should happen with kids. And, I'm not a rocket scientist, but I figure, I've been a parent. I am a parent. And if you're going to do something about my kids, then shouldn't I be at the table, because I'm the one that is with them 24/7, and I'm going to be able to tell you if that behavior is true and consistent, and, So we made a kind of a policy directive. I'm not real sure exactly how policy happens. I know we have this whole policy section, and they have to write, and they have to search law, and they have to do all this stuff. But basically I say, what I want to happen next? And they make that become policy. And so I said, I don't want there to be a meeting at the table. I don't want there to be a table if the foster parents aren't at the table. Because you can't make decisions about kids in custody without the people that care for them day in and day out there. And so let's have those foster parents be at this table. Now, I know there's always two sides to every story, and I know sometimes foster parents get a little irate with us and want some stuff that we can't do, but let's still get at the table and hash it out and figure it out, and at least we know where we are with each other. After Katrina, we had a lot of foster parents that came back to us to say, not that I'm leaving, because that was a big question. Everybody in the nation wanted to know, how many foster parents did you lose? And the incredible answer to that was not one. Not one. We also did not lose a single foster child, which was absolutely amazing. And thank you. We had, and I'll tell you, I love these Katrina stories. I had a kid call me. I don't know how he got his name, but it was a foster kid, and he was 15, and he had, this was like, I don't know, 7 days out. There's still water all over the city. Somehow he got my number, and he called me, and he said, I want to know how much trouble I'm in. And I said, well, what'd you do? He said, well, I stole a car to get out of town, and he was in Houston. And he got out of town with his 18-year-old girlfriend. And I said, okay, so you stole a car, you took an 18-year-old girlfriend, and you got to Houston. What that sounds like to me is that you used a lot of ingenuity, you kept yourself safe, you rescued another person, so I don't think you're in any trouble at all. I really think you need to come home, ditch the car. I don't want to have to deal with them. But just, put the car back somewhere close to where it was. We'll say the water carried away. And just call your worker and tell her you're safe and where you are, and let's just kind of get you stable again. So we had some incredible things going on during Katrina. But not one single one of our foster parents said, I don't want to be a foster parent anymore. But what they said was, I can't take 3 kids. I can't take 5 kids. They now live in Shreveport, which I don't know if you know anything about Louisiana, but there's South Louisiana and there's the rest of Louisiana. South Louisiana is Catholic, Cajun, Creole. North Louisiana is not. North Louisiana is Southern Baptist, looks just like Mississippi, Alabama, and Georgia, the Bible Belt. So North Louisiana translating South Louisiana, not always really good, easy, seamless shift. So now I've got foster parents out of Louisiana living in Shreveport. They're going to churches where everybody doesn't know them. They don't have the pharmacist who will fill the script and ask about paperwork and everything later. They don't have the neighborhood system that understands that this is a revolving door over here and there are kids of all sorts of shapes and sizes in and out all the time and you just love them all and don't worry about it. And so they really were stretched beyond their capacity to provide the same kind of care they had been providing before. So we found ourselves with a shortage of beds, foster homes, not because we lost any of the committed foster parents, but because they just couldn't do the same work. So we needed a massive foster care campaign, and we did that. And got a lot of new foster parents. But while we decided to do that, we decided to rewrite our training, to retool how we work with foster parents, and that's where the culture change and the system change really had to meet in the middle. Because if you came in with the mindset and that old school of social work that I know what's best for this family and I'm going to tell this family what's best for them, that's not working now for us. And I don't know that it works well for anybody at any time, but it really doesn't work well for us in Louisiana. And so the belief as we're shifting into this new world vision is that foster parents are going to be at the table. They're going to be part of the training. They're going to be part of the conversations every time. And one of the things I had learned about my staff is that they don't break the law. They're real clear about that. And they were always telling me, Marquita, if you do that, you break law. And I'm like, well, I don't look good in jewel, and I don't look good in orange. It's not a jewel tone. So I'm not going to prison. I'm not going to do anything that's going to push us so far over an edge that we're going to be legally in trouble here. So they won't break law, but they will bend policy till it looks like pretzels. So I said, okay, here's what we're going to do about that. We're going to have a foster parent bill of rights that we're going to put in law that says how we act with foster parents. because sometimes you just have to do what you have to do. And so to get all staff to that place of believing that foster parents need to be at the table, we just put it in statute that foster parents have to be at the table. And so the foster parents are loving this, and they're getting engaged in a way that they've not been engaged before. And so it's just a constant looking for new opportunities that shift you into the total belief system of what the CSFR stands for. How do you get well-being? You get well-being when you're working hand in hand with all the people that have anything to do with the child's life. And that's a foster parent and a birth parent and all the other family people. But that's one of the things that we had to do. So we kind of, we started at the front end with getting the alternate response. We beefed up our community-based services. When I told Renda to go, Renda went like a bat out of hell. I mean, it was just every time I turned around, she's running down the hall with a new program and a new thing that we could do. And oh my God, oh look, we can do this. And if I could only have like just $500,000, or if I could only have like 50,000, I was like, just go do it. We'll figure out the money. We'll figure out the money. That's why the budget people keep going, oh, dear God, here she comes again. And so we keep figuring out the money to put as much as we can into that front end. And so we get our foster parents buoyed up. We've got them in training. We've got them in decision-making processes. And this is the high, lofty goal. Not every foster parent's happy in Louisiana. Not every foster parent's at every table. Not every foster parent is doing everything that we want. But that's what we're striving for. And we're well on our way down that path. So then we really started looking at the kids in the deep end of the foster care system in that residential treatment. And we have spent a lot of time and energy trying to do a residential redesign. We created the acronym, because of course we had to have an acronym, for what we were going to do and what we were going to call this continuum of care. And it's a mouthful. It's LIFTS, L-I-F-T-S, LIFTS. It stands for Leading Innovation for Family Transformation and Safety. So try to get that to roll off the tongue of your staff across the state. But we've got LIFTS down. Everybody knows what LIFTS is. But what is so interesting is that everybody took their part of LIFTS. And if you ask them to define LIFTS, the residential folks will tell you LIFTS is the residential redesign. If you ask the prevention folks what LIFTS is, they say, oh, it's all about prevention. If you ask the front end, the CPI folks, oh, LIFTS is CPI, we've got alternate response. That's what LIFTS is. So it's really funny because it really is about that, how our perceptions are, what our perceptions are. And, we see the world like in our little bit. But if you add all that together and ask all the staff, you would get the picture and the whole wide scope of LIFTS. And so when we got into the residential piece of this, we had 18% of our foster kids in heavy, deep-end residential or group home. I use that term to encompass everything. 18%. What the best standard practice was saying to us is that we needed to be at 10%. That really on almost any given day, 10% of your foster care population will need that kind of therapeutic intervention. Well, unfortunately, in Louisiana, we were using it as a placement more than a therapeutic intervention. And so kids were going into residential to grow old and die and go home. I mean, it was horrible. And so we really had some good residential facilities, but we didn't have standards and quality of care that we needed. So that's been a huge chunk. And as we've tried to explain to people over the past couple of years as we've been doing this work, the prevention piece shot off like a bottle rocket. CPI piece went pretty fast. Foster care piece went pretty fast. But the residential piece was just kind of on hold. And what we kept saying to the residential providers was, we're coming. Be thinking about what you want to do, because we're about to turn your world upside down. We've got to get all this other stuff in place first, because if you don't have the community-based programs and you don't have the therapeutic and regular foster care to step these kids down, there's no way to go. So, again, not rocket science. We've just got to get this ready, but we're coming to you. So be thinking about what you could do to shift your business model to get to a place where you do what we need, which is more transitional living and more supervised apartments and more multisystemic therapy or more working with birth families in reunification, whatever it is that you think you're good at that's not about bricks and mortar, because we're fixing to blow up some of the bricks and mortar. We're not going to use all these beds. So we really need you to shift and think a different way about how you do services for us. So I don't know if they believed us. I think they were a little scared. I also think they thought they could outlast, because, governors change, secretaries change, somebody else, they'll get a new one and we'll go back to the way it was. But so far so good. We're still plugging along. And so now we're to that place where the residential providers are having their moment in the spotlight in the lifts continuum. And they're really figuring out very quickly that we're not using the same kind of beds that we used to have, because we are down now to 8.5 or 9% of our kids are in deep end. Isn't that awesome? We are really excited about that. And of course, then that brings the other challenge, because, no good deed goes unpunished. That brings the other challenge of making sure that we're stabilizing these placements. And we step these kids down, and we're doing a lot of reunification with birth families and relative families, a lot of that, which, could mean a couple of things. Could mean that we just put kids places and left them and forgot them and didn't stay connected. Or it could mean that families have changed. From the time that we took custody until now, families have stabilized, things are different. Maybe the boyfriend that was the abuser is gone, mom's okay. So, a lot of dynamics in this work. But we've brought back a lot of kids into their family. But we really need to be careful, and our constant caution in this is that these placements are stabilized and that we just don't have a downturn and then a spike back to get these kids in care. And then the other piece was probably the part that tugs at me the most, because I've always worked with adolescents in every aspect of my life, is the kids that age out in our system. And they're the ones that break my heart. And, where do you go for Thanksgiving? And I'm 55 years old. My mother still cooks my Thanksgiving dinner. I don't know how to not go home for the holidays. And I don't want to know what that feels like. And so that's the part of the system that tugs at my heart the most, I think, is that part that says, what is it, stupid goal, APLA or whatever, that you have an alternate plan of living. That's not a goal, that's a cop-out. How in God's name can we look at somebody and say, you can just turn 18 and be done and get to leave? That's just fingernails on a chalkboard to me. So we're really looking at how we do that part better and how we reunite these kids and give them a home to go to. And there have been so many parts of this. This has been fun, y'all. This has just been fun work. I know that we deal in a lot of horror and a lot of sadness and a lot of really days that you read the paper, the fatality reports that come in, you just want to hide in a hole and ask why the gods let this kind of stuff happen in the world. But beyond that, when you see the families that you're putting back together and the families that you're creating and the unity that's coming out of this and the courage that it takes to work in this kind of system every day, this has been a joyride for 5 years for me. It's just a blessing to be able to do this work. And we really were able to say to our kids aging out staff, which we didn't have before, so we got to get some, so that was really cool that we actually could say now we have staff for kids aging out. Because my belief is, civil service is a very weird system, and I call where I used to be the free world, and civil service isn't. And so I keep trying to figure out, civil service says you have to do this, and if you're not on an org chart, in civil service, you just don't have any value, and you don't get any resources, and nothing happens. So I said, okay, so let's put youth aging out is one of the big things. We call them divisions and then sections or units. I never get it right. Let's make one of those for kids aging out, because then they're on the paper. And what I've learned about this staff, you talk about compliance driven, if it is on the paper, it is going to get done. So we're going to put youth aging out on the paper, and they're going to have their own box and all their little lines and charts. And so now we're going to have staff. We're going to have human beings that are going to work just on the aging out process. And when I was at the permanency conference in D.C. a couple of years ago, we we didn't take a youth. And so I said, dadgum, when I come back, I'm bringing a youth. That's my big goal. So we took a youth this time. And so caught up in the heat and passion of the moment, I said, we're going to have youth advocates, and we're going to have staff, and we're going to hire former foster kids to work for OCS. And so now we are. I don't know how we're going to fund it. I'm not quite sure how we're going to find them. I don't know what the job description needs to look like, but we call Chris for that and say, Chris, we need a resource center that can tell us what's a job description for a youth advocate, because I don't have one, but I know I need to hire some because I made this big public commitment. And Devin is with me, and Devin is the president of my youth advisory board. And Devin has me on speed dial. And Devin calls me to hold me accountable to the commitment I made in Washington. So we got to figure this out, because we're going to have youth advocates, and their role is going to be help us with this aging population, this transitioning youth population, and making sure that we are hearing their voices, because that's what's the most important. It's very easy to sit in chairs in management meetings and have all the pressures from the public and the legislator and the judges, oh dear God, the judges and the legislator and the governor and the budget people telling you all the stuff that you have to do, can't do, should do. And you get really lost in management. And so if you don't have authentic voices guiding you, you stay lost in management. And so since I'm not a frontline worker, the only way that I can stay connected is to listen to my foster parents, to listen to my youth, to listen to my staff, to be in the field, and to hear what I need to hear from the people who do the work. I just get to walk alongside it and you know, figure out what's the best place to put the money at this moment in this time. I'm not a social worker. I don't do the work. I don't go out and do investigations. I don't work in adoptions. I don't work directly with kids in crisis. And being that far removed from it can give you a couple of things. It can give you some vision and some clarity, but it also can get you lost in the management if you don't pay attention. So the part for me that's really critical is to be able to listen and to hear the people that really do the work and really know the system, and the people that are the system, the families that we investigate, and the foster kids and the youth talk to us about what they need to do. That has been our journey for the LIFTS initiatives. We're going to end with one of the voices of one of our youth that has helped guide our work to believe that I truly have come to know and love and be amazed by the child welfare staff in the state of Louisiana. They're incredible, remarkable people, and I know they're duplicated in every state in the nation. We do really serious, life-changing work. I was at the Marine Museum that they just opened out by Quantico yesterday, and there's a quote on the wall that says, "A lot of people go through life wondering if they ever made a difference." That's not true for Marines. And I stood there and just overwhelmed in the moment thought, that's not true for child welfare workers either, because we know that every single day what we do makes a difference. We save lives. We create families. We reunite families. We make wholeness out of brokenness. That's miraculous work. And it is a gift to be with you and a gift to do the journey and the walk with you. I am awed by the calling that you have and the commitment you have to doing this work. So I thank you and applaud you for it.
I guess you could say I had a pretty normal childhood until about the age of 11. Things started to go really wrong. I didn't know how to deal, so I started cutting and running away. I ended up getting taken from my family and put in foster care. I entered care on Friday, August 13th, 2004. When all that happened, I was angry, scared, confused, and sad. I felt hopeless, so I turned to drugs to make it all go away. But it didn't. it just got worse. Through all that, there was one person who I felt was really there for me, a foster care worker, Ann Dugas. She put up with all my crap and still treated me like one of her own children, and for that, I give her a huge thanks. I've been in many homes, but I feel like the one I'm in now has had the most impact on my life. The family is really amazing. They have showed me that being in foster care isn't that bad. They have helped me realize a lot about myself. The most important thing I've learned is that what happened to me isn't my fault, and it feels good to know that. My family has also helped me gain a relationship with God, and that's pretty awesome. I'm 17 and a senior in high school, and I plan on going to college. I've decided that I would either like to be a paramedic or a foster care worker. I can't decide between the two. I've already received my first responder and CPR certification. Some of my hobbies are theater and singing. I really have a passion for music. My hope for the system is that each and every youth would be heard, and that they would be treated equal. My hope for foster parents is that they would give teens a chance. Being in foster care, I can say that having a family is a really big deal. Most teens just want to know that someone loves them and someone cares. Knowing that makes a huge impact on their lives.
Can we just say thank you to Will and Chris and Marquita for that great presentation?